We thank God and thank Mr. President for bringing this university to our own region, to our own senatorial district. Before now, nobody would have thought that it was possible, but with God, all things are possible. So we thank Mr. President, and we thank all those, including David Mark and others who have helped us in ensuring that this dream has come to be. As far as students' admission or intake is concerned, we should aim for the best. Like I want to say very clearly that this is not a local university. It's not an Idoma university. It is conceptualized to be an international university. So nobody should come from a miracle center with results to say that he's coming here. He will not come, because fortunately I have enough experience, sufficient experience, and others who will join me to screen out fake results, because there are very many miracle centers all over the country, including those from the Benue South Senatorial District. We will expect that they should reduce. If anybody coming with that result will not be taken. Even staff, we have all sorts of people with all sorts of degrees and certificates. We will not work with certificate alone. We will work with knowledge, skills, and performance. So my plea and my advice is that anybody wanting to come and work or to get enrolled in the university as a student should be prepared. One, he should have the requisite qualifications. It's going to be a university where competition will be the order of the day. And therefore, they must be prepared. It's not enough to say because I'm from Benue South Senatorial District or I'm an Idoma person, you'll be admitted. There's no guarantee for that. Yes, the institution is located in a place, and that is in Otukpo, in Benue South Senatorial District. But the content and context is not only for Benue people, not to even talk about Idoma alone. So we should be prepared. Anybody coming should be ready. And I mean what I'm saying, so that nobody will have an illusion that because the universities are very close to their doorsteps, they can just walk in and walk out. It will not happen. The way and manner this university came took a lot from some people to ensure that this university came. The assurances that it's going to be an international university and the assurances that it will be a federal institution is very, 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 very germane. And therefore, anybody coming should be prepared. It's not just, even if when you get admission, you must be prepared to read and work. There is not going to be any sale of handouts in the university. They want to make it very clear to lecturers, to would-be lecturers, that we will not entertain any sale of handouts. In medical education, we don't sell handouts. So nobody should come with an illusion that is going to sell handouts. Students must, if you have been wearing a toga of cultism or alcoholism or drug addiction, please wear those off before you come as a student, because we will get it very quick. We get you very quickly. We'll get the instruments that will detect these things, because we don't want anything that will interrupt the academic profile and academic calendar of the very brand new Federal University of Health Sciences. I probably will need to say what the university stands for, even though the nomenclature is Federal University of Health Sciences. It's also true that why it is science-based, it's not only doctors that will be trained. We train doctors, we train nurses, we train pharmacists, we train radiographers, we train medical laboratory scientists. As a matter of fact, we have a faculty of biomedical engineering. You will recall that most of our equipment are imported without commensurate technical knowledge and skills, and therefore they become equipment that will be like Nigeria becoming a dumping ground. So we found that as an important component of our contribution to knowledge and development of Nigeria. So there will be a faculty of biomedical engineering. Apart from medicine, there is going to be dentistry. and then we will have faculty of allied medical sciences. We also would, in our academic brief, we also have faculty of water resources engineering and environment. So those are some of the things that we would need to have. But to answer your question specifically, we will have to start from a place. And starting from a place, we will start from 100 level, which is Faculty of Science. Therefore, we will start with Faculty of Science and begin to prepare the university and college. Actually, we have a College of Medicine in the university, which is headed by a provost. So the provost has already been appointed, and the deputy provost has been appointed. So we will have basic medical sciences, Faculty of Basic Medical Sciences, which will include physiology, anatomy, biochemistry, pharmacology, and the rest. After that, then we will then go to the clinical sciences. And fortunately, I must say too that the president has approved the General Hospital as a temporary teaching hospital, and this should be, and it has been given out to the university by the Benue state government, and we are grateful for that. So the formal handing over will come very shortly. I must say that it will come very, very shortly. But we have to prepare the teaching hospital for the medical students and the nurses that will be trained. And in that wise, we will begin to appoint consultants and lecturers that will begin to work in the hospital, even when students are getting ready. Apart from the fact that we're going to establishing a university, we need to improve the health of our people. The whole of Zone C has no single consultant, while the Doma people can boast of consultants all over the world. And we believe that if with this university and the teaching hospital, we will then begin to get consultants, consultants of international repute to come, not just Idoma people, but anybody who has the requisite qualifications and knowledge will come and work in. So, but the fallout of the university is that the teaching hospital will begin to provide services to our people, and therefore the health status of our people should improve. Maternal deaths or death in pregnancy and childbirth should reduce. Childhood deaths should reduce. Deaths, from common conditions, diabetes, hypertension, should also reduce. So it is, and that is a big fallout as part of the gains of the university. And we think that will bring development. The university will bring more development to this region. I mean, there's no doubt about that. Many universities many communities that have developed through education. And I believe that this will help us to develop our immediate community and then the larger community as a whole. With the appointment of principal officers, vice chancellor, registrar, bursar, librarian, council is in place. So it has kicked off. All you want to say is that when I've been academic, I'm an academic. So, but you're talking about admissions. We expect that this session we will admit students. As a matter of fact, that's why I'm back home, to make sure that everything is placed. I don't know whether you've gone to the place, but you need to go there and see. Even though a temporary site, it's almost complete, about 95% complete. The lecture halls have been furnished with lecture materials. Offices have been equipped, and therefore the commencement will be very, very soon.